Implants came to light because we found out that titanium and now zirconia can fuse to bone, and that process called osseointegration makes for a solid structure that you can put a tooth on. So a lot has changed to make the process pretty much painless these days. From a single standpoint, single tooth, in the front of the mouth, you're talking about having something that's an immediate. So we cut down the time in half because almost every single tooth in the front of the mouth, we can remove the tooth and put the implant in at the same time, so 4 months instead of the traditional 8 to 10 months before you have a tooth there. On top of that, we've come up with a newer technology called Socket Shield, where we can actually predictively keep all the bone and all the tissue around the front tooth. A lot of people will show the gums when they smile, and you have to have that spot on so it's the best cosmetic result you can get. And in the same time, we can deliver something more permanent in the meantime, so you don't have to use a removable device like a flipper or an Essex retainer. Today, we can offer a mill that we mill it in our lab in our basement. It's made out of a composite, like a PMMA it's called, but it's like a composite tooth that we actually bond on during the healing process, so they never go without a tooth. It's a nice option cosmetically for the patient so that we can get to the point where it's time to actually restore and make it a perfect tooth. We also do full arch cases, which is everything from removable dentures to teeth in a day, where you come in and if someone is down to the point where they can't restore what they have remaining, we start looking at bigger options, and that involves a lot of work. There's 5 implants per arch, but you can leave with teeth in a day, and that's huge. We can place the implants, we can get them out the door with a temporary device that looks just like their natural dentition while everything heals. 4 months down the road, we can turn that into usually fixed zirconia, something much stronger that looks gorgeous as well once everything is healed. Putting a titanium implant in bone sounds painful, but I can tell you that that's probably the easiest part of the whole problem. Removing a tooth, extractions, we have things that we can do to help with that. We do a lot of steroid injections at the time of surgery. We use long-lasting anesthetics so that it lingers a little bit longer so you can get ahead of the pain. I haven't prescribed narcotics in a long time, and I think that's part of the way dentistry is going, because we're just being less traumatic to the patient so that the experience goes a lot smoother. As far as placing the implant goes, very little pain. We place implants every single day in this office. I call all my patients the next day. Every single one is just like, seriously, that's it? Because it's pretty easy. If you do the process right and you follow the protocols, it turns out and there's zero pain with an implant.